Hi, my name is Julia Day, and I'm a nurse practitioner student at the University of Maryville. Today I'm going to be completing my head-to-toe exam on my volunteer, Kevin. He was instructed to put on a gown, empty his bladder before arriving into the room. I've obtained a full set of vital signs, including a height and a weight. I've checked his distance vision using the Snellen chart. His distance vision is 20/20. I checked his near vision using a Rosenbaum card. I've washed my hands and I am now ready to begin the exam. I'm going to start with inspection of the skin. His skin is intact, it's pink, it's dry, it's warm to touch. I'm going to now examine his head. His head is normal cephalic. His scalp moves well. The skin is intact. He has good hair distribution. I feel no masses or nodules, no deformities. Next, his face is symmetrical. Next, I'm going to palpate his sinuses. I'm going to start with the frontal, the maxillary, the ethmoid. Any tenderness there?
No.
Okay, no tenderness to the sinuses, and I feel no inflammation or masses. Next, go ahead and close your eyes for me. Open them. Smile real big. Clench your teeth. Open your mouth. Stick out your tongue, wave side to side. Very good. I'm checking cranial nerves 3, 5, 7, and 12, or the oculomotor, the trigeminal, facial, and hypoglossal nerves. Next, I'm going to check his light sensation. I am going to touch your face. I want you to close your eyes. I want you to tell me if it feels soft or sharp.
Soft. Sharp. Soft. Sharp.
Good. His light sensation is intact. Next, I'm going to be examining his eyes. Go ahead and open your eyes real big for me. The irises are clear. The sclera is without jaundice. His conjunctiva is pink. I see no lesions, no nodules. Go ahead and close your eyes for me. I see no lesions or nodules to the eyelids, no exthalsemia noted. Next, I'm going to inspect his inner eye. Go ahead and, his eyebrows are even and have normal distribution. His eyelashes grow up and out towards the outer canthus. Next, I'm going to palpate your lacrimal glands. Any tenderness there?
No.
Open your eyes. I see no excessive tearing or dryness to the lacrimal glands. Next, I want you to look at my pin light here. Follow. His 6 cardinal fields of gaze are intact. I see no nystagmus. Go ahead and cover your eye. Look at the light. Uncover. Look at the other light. Very good. Okay, let me look at your pupils here. Very good. His pupils are equal, round, reactive to light and accommodation. Next, I'm going to check his red reflex with my ophthalmoscope. Go ahead and okay, red reflex is intact in that eye. Let's see this eye here. Red reflex is intact in that eye as well. That's checking cranial nerves, the oculomotor, the trochlear, and the abducens. Next, I'm going to look at his ears. The outside of his ears, the auricles, are without lesions or nodules. I'm going to tug on them. Let me know if there's any tenderness.
No.
No, tug test is negative. Next, I'm going to look inside of his ears. The ear canal is pink, free of nodules or lesions, no excessive cerumen. His tympanic membrane is pearly gray and intact, no bulging, good cone of light, bony landmarks are present. Let's look at the other ear. Once again, the ear canal is pink and intact, no nodules or lesions, no excessive cerumen. His tympanic membrane is intact, pearly gray, no bulging, good cone of light, and bony landmarks are intact and seen. Next I'm going to do the Weber and the Rene test. The Weber test is checking to see if he hears out of both ears equally. The Rene test is checking for bone and air conduction. Air conduction should be longer than bone conduction. We're going to start with the Weber test. I'm going to place this on top of your head, and I want you to tell me if you hear out of both ears equally.
Yes.
Okay, next I'm going to start with the Rene test. For the sake of the video, I'm only going to do one ear, but for a full head to toe, you would do both ears. I'm going to place this at the back of your ear. I want you to let me know when you no longer hear it. Then I'm going to place it at the front of your ear. The front of your ear, which is air conduction, should be longer than the back of your ear, which is bone conduction.
Okay. Okay.
Very good. His hearing is intact. I'm going to do the whisper test. I want you to cover this ear, and I'm going to whisper a word, and I want you to tell me what it is.
Apple.
Very good. Let's do the other side.
Orange.
Good. His hearing is intact. He has no hearing difficulties. That's checking cranial nerve number 8. Next, I am going to inspect his nose. I'm looking at the outer nose. I see no deformities, no traumas. His nose is midline, symmetrical. His septum is midline, no deviation. Go ahead and cover one nostril and breathe in and out. Do the other side. No occlusion in his nares, no obstructive airflow. Next, I'm going to look inside of his ears, his nose rather. Go ahead and look up here for me. The turbinates are pink. I see no purulent drainage. I see no nodules or lesions, no polyps. His nares and nasal area is intact. Next, I'm going to look at his mouth and his oral pharynx. His lips are without cracking or dryness. Next, I'm going to inspect the inside of your mouth. Open your mouth real wide for me. He has 32 white teeth, no excessive dental caries. Let's look at the inside of your mouth here. The posterior oral pharynx and hard palate are intact. Lift up your tongue. His tongue's without lesions or nodules. I see no evidence of oral cancer. Go ahead and say ah.
Ah.
Uvula rises midline. Let's check his gag reflex. Very good. His gag reflex is intact. His tonsils are visible, but they are not enlarged. This is checking cranial nerves 9, 10, and 12. The glossopharyngeal, the vagus, and the hypoglossal nerves. Next, we're going to inspect his neck. There's no lesions or masses. His trachea is midline. There's no deviation, no evidence of a goiter. I'm going to palpate his thyroid. Go ahead and swallow for me. Very good. I feel no masses or nodules. I'm going to palpate his pulses, one side and then the other. Very good. Pulses are intact. I feel no JVD. Go ahead and I'm going to check some strength in your neck. Go ahead and push forward. Very good. Backwards. Side to side. Very good. Turn your head side to side. Very good. Chin to your chest, all the way back. Shrug your shoulders. Very good. Good muscle tone. Next, I'm going to palpate his lymph nodes, and I'm doing that with my second, third, and fourth fingers. I'm going to start with his preauricle, which is right here in front of the ear, postauricle behind, occipital is the base of the skull, posterior cervical down the ear, supraclavicular is above the collarbone, tonsillar is the side of the chin, submandibular under the chin, submental is also under the chin, superficial cervical right here in front, deep cervical in front, axillary underneath the arms, and epitrochlear is at the elbow. I feel no edema or irregularities there. Next, I'm going to listen to his carotid arteries and to his thyroid. Hold your breath. Breathe. Hold your breath again. Breathe. Hold your breath again. That was checking, all of that was checking the spinal accessory nerve. I hear no bruise in either his thyroid or his carotid arteries. Next, I'm going to be checking his upper extremities. Go ahead and stretch your arms out here for me. The skin is pink. It's warm to touch. Good hair distribution. It's dry. Go ahead and lift your arms up. Do full range of motion. Any tenderness?
No.
Good muscle strength, muscle tone, good full range of motion without any tenderness. Next, I'm going to check this capillary refill. It is brisk. I see no clubbing or cyanosis of his fingers. He has good skin turgor. Go ahead and push, pull. Very good. Good muscle strength. I'm going to check his brachial pulse and his radial pulse. Those are good, 2+ intact. Next, I'm going to look at his back and his posterior chest. Go ahead and turn around here for me. Good deep breaths. Very good. He has good expansion. He's got a symmetrical back. I see no abnormal curvature of the spine. His respirations are even and labored. Go ahead and say 99 for me.
99, 99, 99, 99.
Good tactile fremitus. Any tenderness anywhere?
No.
Very good. I'm going to percuss the costovertebral angle. Let me know if there's any tenderness. Any tenderness there?
No.
Any tenderness
No.
there? Very good. Next, I'm going to listen to his posterior chest. Good deep breaths. Again. 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 Very good. I hear no crackles or wheezing. His lungs are clear in all lung fields. Next, I'm going to measure his diaphragmatic excursion. I'm going to start from the top, and I'm going to percuss down until I hear from resonance to dullness, and then I'm going to do that from the bottom and from resonance to dullness again. The normal diaphragmatic excursion is 3 to 5 centimeters. I'm going to measure his now. Mark it, and then come up from the bottom, percussing, And it looks like his is about 3.5 centimeters. So he has normal diaphragmatic excursion. Go ahead and turn around here for me. I'm going to listen to his anterior chest, lungs, and heart. His chest is symmetrical. Any tenderness there? His respirations are even unlabored. He's not in any respiratory distress. He has good chest expansion. He's not using his accessory muscles. I feel no pulsations, no heaves, no thrills. Feel his aortic pulse. Next, I'm going to listen to his lungs. Good deep breath. Next, I'm going to auscultate the heart sounds. The aortic, the pulmonic, Erb's point, tricuspid, and the mitral. S1 and S2 are heard, and I hear no murmurs in his chest. Go ahead and say 99.
99, 99, 99.
Next, I'm going to inspect his abdomen. Go ahead and lay down here for me. He has a rounded abdomen. His umbilicus is midline. I see no scars or lesions. I'm going to listen to your bowel sounds. He has active bowel sounds in all 4 quads. Next, I'm going to listen to the arteries. Listening to the aortic, the renal on both sides, the iliac on both sides, the femoral, I hear no bruise. I'm going to check the femoral lymph nodes and his pulses. His lymph nodes are not enlarged. His pulses are intact 2+. Next, I am going to palpate for the liver and the spleen. The liver border is going to be in the right upper quadrant. Palpating here and come up. I feel no enlarged liver. Next, I'm going to check the spleen, which is going to be in the left upper quad. I feel no enlargement of the spleen. I'm going to do some light palpation. Any tenderness there?
No.
Okay, now I'm going to do deep palpation, feeling for masses or any abnormalities. Very good. No tenderness, dullness is heard throughout. Next, I am going to palpate for the kidneys. I'm going to make a sandwich-like motion, have him hold his breath while I palpate, one on the abdomen and one underneath the back. Hold your breath for me. Again. I feel no enlargements of the kidneys. Next, I'm going to feel for aortic pulsations. I do not feel any. Next, I'm going to have his raise his head up while I palpate the abdomen. I'm feeling for hernias. I feel no diastasis rectus or hernias. Next, we're going to check his feet and his legs. Go ahead and sit up here on the side of the bed. I see that the skin is pink. It is warm to touch. He has good skin turgor, even hair distribution, no edema. Next, I'm going to palpate for pulses. His dorsalis pedis, which is on the top of the foot. His posterior tibial, which is on the inside of the ankle. And then the popliteal, which is at the back of the ankle. He has good cap refill in his toenail beds. And once again, there is no edema. Go ahead and stand up. I'm checking his, oh no, sorry, sit down. I'm going to check his reflexes. I'm checking his brachial reflex. Very good. I am checking his knee reflex. Very good. I am checking his Achilles. All of those reflexes are intact. Next, I'm going to be checking his muscle strength and musculoskeletal system in his lower extremities. Go ahead and stand up. Swing your leg out that way. Go sideways like you're doing the scissors. Do the other side. Yep. Very good. He has good abduction and adduction. Let's check your back. Cervical spine, thoracic, and lumbar there is no abnormal curvatures, no kyphosis, scoliosis, or lordosis. Any tenderness there?
No.
Good. His hips are aligned. Go ahead and bend forward. Go ahead and stand straight up. Any tenderness there?
No.
His musculoskeletal system is intact. This does complete my head to toe assessment. Thank you.